daily dose or a dose of Dr. Drew.
Are we on? Very good. Well done. So we're trying to hit you up with our daily dose from somewhere else. We're out in a different part of the country, different environment, different equipment. So apologize if anything gets screwed up. I'm looking at the restream comments.
Nothing's coming up.
Nothing's coming up.
Oh, no.
We're not streaming.
Well, there's 11 people watching.
Okay, so somebody, you're there, but you're not talking, or maybe you're talking, but I just can't see it.
Okay, we got it.
Now,
Yay, echo. Somebody says echo.
There's an echo. Okay, thank you for that. We're going on and off on the screen here. You'll notice. Now we're off.
Oh, yeah? Says on to me.
Let's see if you guys are talking.
Okay, so this is a test run.
This is
It's,
test.
oh, here they come.
There we go. You live in that. So we're trying to do this from, the sound is screwy in the sense that it doesn't sound good.
It's not the same as at home,
I'm
obviously.
not loud enough for a second.
Oh, you're not loud enough?
So we're going to fix that. 1 second. Thank you for bearing with us. This is all new environment, new equipment.
Is that better?
How's that? 1, 2, 3, 1, 2, 3. Is that better? Hello, guys. Sound better? We don't have our fancy microphones here. Can we hook in our fancy microphones?
No.
Hi, Alice. Sound is okay from Ava.
How's that?
Okay.
Is that better?
Sound is okay.
Okay, I just made it louder. Did that help?
There's something about you losing already. Hold it closer to your mouth. Okay.
Yeah, the mic
You
is.
hear Susan
It's
loud
on the
and clear.
right. There it
You
is.
hear Susan loud and clear, but not me.
Turn the mic around. Maybe
Just
it's.
so you know, that means you're getting it from that mic.
Oh, that's
So
not good.
hold on. That's serious.
All right. Well, it could be that. Let me hold on. Just a second.
1 second. 1 second.
How's that?
I'm too low, they keep saying. How about that? Is that any better? I gotta see.
We just did a big test run, and now it's not.
Cannot hear it. Or can hear it.
Okay.
Better? That's better.
Testing.
Is
1,
Susan still clear and I'm not clear? Wrong mic. Yeah, that's what I think. Much better. Okay. So here we are. We're coming to you from the Big Apple of Manhattan. Hold the mic towards my mouth. All right.
No, it's fine.
I will do that. Is that any better? Somebody's saying good, fixed, perfect, yay.
Am I a better?
Susan is still louder. She is a woman, it says. So, okay, clear now, amazing, did it. Okay, loud and clear, beautiful. So thank you, I got it. The note taken, everybody. Thank you for helping us solve these technical problems. So yeah, we're in Manhattan and we're doing this from a different location, and we want to be able to continue doing these things for you guys. So here we are. I've got the restream going so I can answer your questions here. We do not have call capability here, but I do have the ability to see your comments.
Look up at the camera.
Now it's too close. Yes, I'm looking at the camera, but I'm also got to watch the restream because you guys are going by pretty fast. Tell about the Periscope crazies I've seen. I don't get to see much Periscope crazy. I was on Wendy Williams today. Miss Pinsky, the producer, is going to show you a picture of that. It was a lot of fun. We just chatted it up. She couldn't talk about the Kobe thing. Have I talked about it on this? I talked about it on the Ask show on Sunday, and it was too emotional for her to even get into it. Again, I'm sure people still have comments and feelings about that. It was just awful.
Terrible.
Yeah, I got to meet him and talk to him for a while, and he's everything everyone said he is. I mean, and beyond. So just a smart, charming, and what's kind of getting my attention, what freaks me out, what I can't get my head around, is here's this incredible force, this vitality that's just snuffed out. It's just hard to do that. You hate Wendy. Why do you hate Wendy? She's lovely. Thank you for listening to Loveline, and we're watching here. Appreciate that. Maybe we can answer important questions here. That's what the goal would be. Will I run against Adam Schiff? No, not this time. Not this time. Though, if things continue to be as horrible in Southern California as they are now, I'll have to do something in a couple of years. Coronavirus, please don't freak out about that. You are more likely to die of flu than the coronavirus at this point. The kinds of, the illnesses you need to worry about, infectious diseases, frankly, there are worse ones right now lurking around. we have a real problem with something called M. avium intracellularia. You should be worried about that. You should be worried about the flu. You should be getting your flu vaccines. And this coronavirus does need to be paid attention to and taken very seriously by people that do this kind of thing, from the CDC and the international organizations. But the average person, let them worry about it. You do not need to worry about it at this point. I'm suspicious. I'm not treating Wendy, by the way. I'm suspicious that we're going to find out that this virus is actually much more widespread than we knew and much milder. Because just think about this. The only people we test for the presence of the virus are people that are very sick. We don't test people with mild upper respiratory infections typically. Though, of course, the epidemiologists will be out there doing samples to try to determine this. And I think what they're going to show is that there's more of it around and it's milder. And so the numerator, the number of fatalities versus the number of infections is going to cause the fatality rate to drop quite a bit. Thank you, Kathleen. I'm not going to right now. Maybe one of these days. I'm still thinking about it, but not this go round. Definitely not this go round. Trying to, whoops, let me see what this one says. Adult child who has very bad mental illness, in and out of jail, homeless. Yeah, doesn't want to take meds. I mean, Mac, you are the guy that I'm trying to help because you have resources, you're a caring parent, you want to help this person, and the laws prevent you from doing it. So I urge you, if you're in California, contact your state representatives, make them pass SB 640. SB 640 would give you the ability to help your loved one if they're gravely disabled. And we got to pass it. It's morally unconscionable. It's reprehensible that they let that bill sit there and they don't pass it. It's really too much. Yes, Kobe did touch us all. Thank you for that, Andrea. Yeah, it's a new virus, but every influenza, every year we have a new virus of the flu. That's how viruses survive. They get into our body and many people's bodies, and our bodies collectively learn to identify them and fight them off. So the virus turns into a new virus, so it continues its life cycle. That's how viruses survive, by becoming new viruses, essentially. So don't worry about that at this point. My reality clinic, you wish that would come back? I do too. Is there such thing as too high a dose of Adderall? Absolutely. Absolutely there is. I mean, Adderall is dextroamphetamine. So just think of what it is. It's a isomer of amphetamine or an enantiomer of amphetamine. Tell Scott Adams I need to speak to Jack at Twitter. I don't know if I can do anything about that or if he can do anything about that.
Scott.
Cousin has severe mental illness that results in physical attack. She's a minor. What can be done? Minors, you can jump in. The parents can jump in at their liberty to help the minor, but adults, you can't do anything. Can I put up a video about that SBC bill on Twitter? You know what? I tweeted today an article that Ramona Russell very kindly wrote, and in there we talk about SB 640. And go look at that article. It should have I don't know, do you want to look at Twitter and retweet that? Mm-hmm. I retweeted something that somebody else wrote about this article that she wrote, and it's worth the read. It's the final word on my position right now on what we have to do with homelessness. So it's so art. It's not just so as opposed to a video. I'd suggest you go to this article. Do I get flu shots and other vaccines? Absolutely. There are not enough vaccines for me and my family. As soon as they become available, I get them. When that HPV vaccine became available for males, and a pediatrician approved it, I gave it to my sons myself. And I give my family flu shots every year, and anybody that's around us, I do as well. Thank you, Shannon. Adam and I do a podcast every day. And now we will not be doing the Ask Dr. Drew call-in show this week on Sunday, though it looks like we're going to be able to keep doing this all week.
Yeah, we do this.
Yeah.
So Kay Smythe wrote the article, right?
No, Kay Smythe is Ramona Russell, but Kay Smythe said something about it, and I retweeted Kay's thing.
CaliforniaGlobe.com.
Yes, California Globe article.
Wait, you're in this article.
So Tammy, what do you think about the Wendy thing today? You're a Wendy fan, so was that okay? Me and Mike doing Loveline again. We've done a lot of stuff, Mike and I, and we'd be happy to work with them again. Oh my goodness, you're starting to scroll by pretty fast, so hold on.
We can just scroll back up.
Yeah, but it's hard to watch as it goes by. Severe emotional domestic. Where'd you go there? Somebody's. See, that's the thing. I lose. I can't. do I know if stem cells can aid in reversing or showing any previous brain damage? It does not look like a very positive intervention at this point. It's see, the fantasy with stem cells is that they magically go where they're supposed to go and turn into new cells. That doesn't happen yet. That's a fantasy still, at least in a meaningful way. At present, stem cells primarily are anti-inflammatory. That's really their main function, though there may be some regeneration of certain cell types in certain environments. Crohn's disease in a young man recently diagnosed. Maybe Caleb should come on and do a whole segment with us. The good news is your your young man friend, Crohn's now is highly treatable with so many of these medications. Ramona, shoot, I'm blanking on the names of them right now, but there are immune modulators now that are available, tumor growth factor inhibitors and whatnot, that are really changed the course of Crohn's. Back when I was, they're very expensive. They can be. Shoot, why am I blanking on the name of it? Humira, and they used to be all we had was cortisone, and this really has changed things. And Crohn's used to be devastation. Oh yeah, I got something to show you guys. Thank you guys.
Where is it?
Hydros vitamin C does not appear to be good.
What did you do with it?
It's the box up there. You had it. I mean, if something as simple as listen, you need to study DNA metabolism if you want to understand cancer. And DNA metabolism is an infinitely complex phenomenon. And if something as simple as a vitamin C contribution would change the course of cancer, believe me, people would be doing that.
Did you put it away?
I didn't do anything. Oh, it's in the black bag right there on the floor.
Oh,
Yeah.
you did put it away. You put it away. Do you have your Wendy bag?
Yes, I got my Wendy bag. How do I feel about Suboxone therapy? I am not.
It's a bag of stuff.
I am not a Suboxone advocate. I'm actually kind of concerned about the excessive use of Suboxone. However, I myself am getting certified. I'm getting what's called a waiver to be able to. Oh, this has to be charged though.
Oh,
Has
well,
one-
you show them how it works.
Okay. And so I'm personally going to get a waiver to be able to use Suboxone as a replacement therapy for opiates because of all the people on the streets.
Okay,
The
move
people
it
on the
back
streets
because it's
are
on camera.
the people on the streets are not going to be candidates for recovery. Which is what I got involved
Turn
in.
it this way.
Involved in the treatment of addiction to be able to maintain. So this thing, I my whole career have been preoccupied with what to do with needles and needle sticks, because what I was dealing with early in my career was the AIDS epidemic, and needle sticks were one of the ways of transmitting it back in the day. And I always thought we had to have a better way to deal with needles. We just had to be something, and these guys invented something, so I've jumped into it. Essentially, you just take your needle, you put it in this port, you hold this down for a few seconds, and it incinerates the needle. Now, it's not charged yet, so I can't do it, but the needle just becomes a nub.
Can you
and
just plug it in and do it?
Would you mind?
Is there a plug?
Yes, there is.
Okay, I'll look at it.
Okay, so there you go. So we'll try to plug it in and do a. And I'm not saying the Suboxone is not an okay treatment for some people. It is. It's going to be life-saving for some people. It's just that it's the excessive enthusiasm, and doctors are prescribing it that really don't understand addiction, and that's very, very troubling. So, let's see. Watch the reply if I want to hear the rest of what he said. Oh, here we go. This is very, very good. Well done. So now it's plugged in, and let's see if I can get it to work. So,
Wait,
yeah.
hold it back more though. Yeah.
So here's the thing. Just drops in here. Let's see if it's. Well, let me just see if it's on. Let me see if it's on. Yeah, it should work. It has to wait just a minute here, though. This thing has to wait.
Give it a little minute.
Thoughts on kratom? Kratom is a weak opiate, and so if you're an opiate addict, you're taking opiates. If you're on kratom, it's just a weak opiate. I'm not an investor in the needle box company, but I am part of the company now, and I have some of the stock. But that's neither here nor there. I mean, that was something that my management worked out. My thing was, I think this thing is going to be a very revolutionary product. And there's going to be one for hospitals, too. You just drop in any size needle, and it incinerates these things.
That's crazy.
Yeah, it's crazy. But no, not an investor in it, per se. But
You invest your time. into
yeah, I do
products
invest my time in it. So here we go. All right, and now, gone. It's just gone. It's a nub.
It's a nub.
It's a nub. It's so crazy. It's the most amazing thing that I can throw that in the trash can.
It takes the tip off. It doesn't take the whole thing.
It incinerates it and melts it down to a little nub.
That's so cool.
Isn't that crazy? And so now this needle that would have been stabbing me in the hand is just gone, just with that little flick of a switch.
Awesome.
That is crazy, guys. That is a technological advance, and I think it should be a standard device.
Device.com.
Any more music after The Masked Singer? I'm hoping to do a few more. My voice has been kind of weird, and that was part of the problem with The Masked Singer. I've got some vocal injuries. I would love to do some national anthems and stuff like that. So far, it's only Jason Ellis that asked me to do national anthems at the Ellis Mania.
Phone's ringing off the hook.
Yeah. You're jealous of Wendy Williams. I'm a ton of, okay. How many cities with needle sharing also have comprehensive effective programs to end addiction? I cannot answer that question, but you're asking about needle sharing. By the way, I have no problem with all the harm avoidance interventions, but needle programs are meant to be needle exchange programs, not needle distribution programs. And now, in Los Angeles, if you want to go to a park, you have to rake the needles out of the park before you go in there. Yeah. Hi, Dan in Newport. Let's see, we're the other side of the country now. Newport's watching us.
We love Newport. I know Dan Donato. I went to high school with him.
Well, can you hear Susan? She went to high school with you, Dan. Well done. That's pretty funny.
Pretty sure.
Or
I did. Somebody with that name.
What was the song I sang on Ben Stein back in the day? You saw that? That was Nemico. It was Nemico della Patria from Andrea Chenier. It was opera. Yeah, crazy. How is the San Diego homeless plan working? San Diego is the only city in the state of California with a negative slope on their homeless population. They are impacting homelessness and saving lives. There you go. It's that simple.
Can't beat that.
Yeah. Daily vitamin brands I recommend. I just take a Trader Joe's men's vitamin. I do supplement with a few other little things, some creatine and some nicotinamide riboside, which I'm convinced has some effect on senescence in cells. So I take a thing called True Niagen. Take some occasionally vitamin C and zinc on top of that, and that's about it. My grandson took acid, had a very bad situation, hasn't been the same since. I have seen a lot of that. That's what concerns me. That's why I get fearful about hallucinogen use therapeutically. I've seen people personality change. I've seen them have persistent panic and mood disturbances. I've seen a lot of crazy stuff from heavy hallucinogen. So let's just hope it's something called the post-hallucinogenic perceptual disorder, which lasts weeks to months, where they seem kind of like out of it and dreamlike, and that he sort of reconstitutes, which more often than not they do, but they do often have some mood disturbances after an experience like that. Let's see.
Tell everybody we just did a podcast.
Metformin, good or bad? Metformin, it seems to be a good anti-aging product. It's one of the ones that does also stand up to scientific scrutiny. It's certainly good for diabetes, and it's good for people with polycystic ovarian syndrome as well. Let's see. I'm reading your comments here. Oh my goodness, they suddenly started scrolling quickly.
But if anybody wants to hear about ayahuasca and psilocybin, we did a podcast about it.
Yes, we did.
With Pauline Pinsky and Duncan Trussell.
Yes. Did you hear what Susan said? Is that up as a podcast now?
Yeah, just let them know.
So there's a podcast up. We did 2 hours on the therapeutic use of hallucinogens.
It's not a podcast, it's a video. It's on Periscope, YouTube.
Video, Periscope, YouTube, Facebook, and it's myself, my daughter, and Duncan Trussell.
Find the links on drdrew.com.
You can find the links at drdrew.com. Can you tell us why San Diego is impacting homelessness and how? They are treating mental illness. They are. You can look at they have a diversity of programs. They're creating beds. They're adding mental health professionals to the police teams, and they're intervening on people who have mental illness and are dying in the streets. Very simple. Suboxone, heroin, 25. Not sure what you're asking for about Suboxone there. If a patient is involuntary, hold on, do you feel it should be responsible for the debt incurred while out of my mind? That is a really interesting question. So that's like saying if you suddenly become unconscious, should you be responsible for the medical care, the cost of the medical care? And the way our system operates now is yes, if your brain stops working and you're taken to a facility for care, you are still responsible, which is why we want to have, please get insurance, everybody. Look up California Care, get something. Wow, this is a huge question. I can't quite read it. Shame on me for something.
Terrible human being, you.
Yeah, I'm a terrible human being. I can't. Okay.
I just want everybody to recognize how fun it was trying to set this up today.
Remember back in the 80s and 90s, Haldol was given to our nursing home residents and they would walk around. Yeah, Haldol is a terrible medication. Oh yeah, Haldol's still around because in some paranoid schizophrenics it can be useful in sort of bringing them down, but it's not something you want people on chronically. That is very much the point. I mean, to your point about the excesses, it's not even so much in the 80s and 90s, but the 50s and 60s, psychiatry was out of control for a 20 or 30 year period. And the state hospitals, many of them were a mess. Some of them were good, some of them were a mess. And we went all the way over in the other direction and completely undid everything we had in the name of those excesses. That was 50 years ago. That was nearly a half a century ago. We have advanced in our understanding of brain science and our pharmacotherapeutics of the brain. It's time for us to bring this back into the 21st century and not be locked into things that happened in the 1950s.
Thank everybody for the hearts on Periscope.
Yes, we appreciate the hearts on Periscope. Are you hearing Susan? Tell me if you hear her or not, because she's having me repeat what she's saying. You may be hearing her.
I'm annoying. I'm sorry.
Thank you, Sadie. I think that is Sadie. That's a very kind statement. I appreciate that.
Thank you.
Who do I think is going to win the Super Bowl? I don't know. I think I'm going to be. I've never been a 49ers fan, even though I like the team and I certainly like this team. So I have a suspicion I might be pulling for Kansas City. I think I'll be pulling for Kansas City, but I don't know who's going to win. These are ridiculous teams, both of them. You're coming in over my mic, apparently.
So then it's still coming out of my computer.
No, over my mic.
Oh. Okay.
Yeah, they're hearing you here.
If I should shut up, just tell me.
Okay. No, just as long as you can hear her. Do I think marijuana induces anxiety? In some people. In fact, it's rather common for it to induce panic attacks. Myself, I think I had that syndrome. And I've seen lots of it now that people are using so much of it. A lot of panic. I can't stop smoking cigarettes, she says. Have you tried vaping? That in all the studies, vaping is shown to be superior to everything else. Then people find they can get down on the vaping, then you can switch over to the gum or something. Obviously, the vaping, there's still concerns about it, particularly on a long-term basis. But in terms of cigarettes versus vaping, cigarettes are 50 times worse. There's no comparison how much worse cigarettes is than vaping. There's Molly, by the way, they recently approved MDMA for use, low dose for use in trauma therapies. What's that?
Wow. Okay, so we redid drdrew.com. I don't know if you knew this, but
yeah,
we remodeled it. And
the homepage.
For the drdrew.tv, and all the shows are there. So if you guys want to go over there and check it out, tell us what you think. We really appreciate it. Caleb worked really hard on it.
Okay, tell us what you think about the new drdrew.com. Caleb's been breaking his butt working on that thing. Yeah, vaping is way better than cigarettes medically. Susan, you are not annoying. It's actually soothing to hear your voice. Poor Susan, though, it's so soothing. Sometimes I fall asleep when she's talking to me. I think that's a good thing. She doesn't think that's so good.
I hope you guys like my whistling intro.
I
don't have music.
Yes, MDMA was recently approved for use in trauma therapies, and it does work. Okay.
All right, you guys get some good questions because we have dinner reservations at 6:30. We're in New York, but also Drew has to get up super, super early tomorrow. You did the Stern after show today.
Yeah, I did the Stern, the wrap-up show.
Cohen.
Look for, I'm going to spend 2 hours with Nikki Glazer tomorrow on Sirius FM from 10 a.m. to noon Eastern. So it's
Yes.
7 a.m. to
Sirius Radio.
10, 7 a.m. to 9 in the West Coast. So that should be crazy because she is one of the funniest people I know.
She is so funny. And I interviewed her first before you on my
Yes.
podcast.
She brought her on her, which is now, Susan, tell us about your podcast. It's coming around.
It's
Wait. Before you do, I want to miss this question. Shar, yes, the ACE studies were for me when they finally came out. I'm like, I've been screaming about this for 20 years. The ACE studies, the Adverse Childhood Experiences study. Guess what? The more adverse childhood experiences you have, the more likely you are to have addiction and mental health issues. And adverse childhood experiences include domestic violence, domestic abuse, divorce, physical abuse, sexual abuse, addiction in the home. All the usual things we talked about at Loveline all those years are now on a scale of adverse childhood experiences. So yes, tell us about your show, Susan.
I have 2 shows coming up, Calling Out with Susan Pinsky. We've done 2 already, and I had Nikki Glazer on way long time ago, and she was the worst guest I ever had. She was
really
not funny at all.
Really?
She was awful.
She just wasn't into it.
Going, huh? And it was great because I did it here in New York, and we did like a remote one. But she was just like terrible. But then she became friends with you because of me. Just
yes,
so you know.
Yes, I know. I remember that.
Yeah, I don't know if she cares or remembers it.
Oh, I'll bring it up tomorrow. Don't you worry.
But tell her she can come back to my show.
Someone wants to know if I have a security team. Shanna, why do you ask that? Because I take the subways. I don't have a security team. All right, I think we got to get going to dinner. So
I can get ready if you want to keep talking.
We'll go another few minutes. Okay, we'll go another 5, 10 minutes. Come back and check on me in 5 minutes. Thank you, Tiggs, on Mixer. Yeah, I'm here mostly because I have this crazy experience medically, treating medical and psychiatric patients for decades, and I'm fearful people aren't. Well, I'm seeing that the younger generation of physicians aren't being trained in the stuff I know, and so I'm trying to just give it back as much as I can and share the information wherever I possibly can. So, good evening, Paula. Susan, they want you on camera, Susan. So once you're willing, can you hear? Yeah.
I'm not really.
What are the most effective way of creating a conservatorship for somebody who's resistant to treatment after multiple arrests on 5150 old? Fortunately, in California, there is some counties and some cities have a pilot program where you can get conservatorships where people have been on multiple 5150s, multiple holds. There you go. Make a small video, you guys, and link the article. All right. I see what you mean. Like some straight to camera video about, and then link the article. Susan, can you do that? If I do a little Instagram video, can you link the article to that Instagram? This shouldn't be too hard, should it?
On live.
All right, we got to do that on Instagram Live.
Yeah, we can put. I don't know. I have to work on that.
Do I try any of the medications you subscribe? I've been on plenty of medications for lots of medical problems.
What happened with this?
Did we lose the stream?
Oh, no. It's just weird. Okay, never mind.
Okay. They're saying hi back.
All right.
What is psychotic depression? The psychotic depression is depression that becomes so severe and that, again, as people sink into deeper and deeper depressions, there can be different physical manifestations through the brain. In the psychotic depression, they start developing psychotic features, such as hearing voices, seeing things, becoming paranoid and delusional, that kind of thing. Thank you, Panty Raid.
I love that one.
Thank you, Sheila. I did.
Yeah, share your Periscope, share your YouTube, share your Facebook. We need more followers. We're trying to, keep this going, and we need a sponsor too. So if anybody wants to sponsor us.
Can I team up with former HUD director Catherine Austin Fitz? That is an interesting recommendation. What is she up to now? Do we know, is she coming in on the homeless thing? Is she concerned about it? That's very interesting. Yes, I would work with Beelzebub if it meant solving this problem. So believe me. Ketamine therapies, excellent. Again, we did a 2-hour special on this with my daughter and Duncan Trussell. The woman we spoke to is a psychiatrist, psychoanalyst who used low-dose ketamine in trauma therapies. Obviously, higher dose intravenous ketamine with anesthesiologists has been shown over multiple exposures to significantly improve recalcitrant depression. So ketamine therapies do work.
So I just showed him a poster of Duncan Trussell.
Okay. And did you, okay.
That's where they need to go. They want to see it. It's really good. It was a very good show.
Here is Max saying many of them don't want the help offered, so it would be great to have mandatory help for them. Yeah, or I don't. Mandatory help is a double-edged sword, Mac. But at least the capacity to motivate care, right? So if you create a bunch of carrots and sticks, people will start to go in the direction you want them to go. And once they start in treatment with people that they learn to trust, then it becomes self-motivating. So I'm not necessarily an advocate for mandatory care. I'm interested in motivated care where you have laws and the ability to enforce those laws so you can move people in the right direction. That's it. Is there a way to treat Ehlers-Danlos? Ehlers-Danlos is a genetic disorder of soft tissue laxity, and it can be kind of painful in the joints. I know there are lots of things to be done. I would consult with physical rehab people, things like that. Here's somebody saying, I'm evil. So tell me why I'm evil. I'm always up for criticism because I'm trying to be better all the time.
Evil genius.
I'm worried about today's young. Doctors not been trained properly. Wait. I feel that I have to be hyper vigilant, staying on top of things. Sometimes I know more than them. This is Gail. Are you a nurse or something? Yeah, and it's not that they're not diligent and not smart. They are. It's that I used to work 120 hours a week to get this training, and I did it for years and years and years and years and years, and there's sort of no other way to get it. I have a little social anxiety, Josh. I do. I have more just generalized anxiety. Let's see. I'm still looking at you guys. Why does lithium cause tremor after a while? That usually means you're in the higher doses, and that can also mean there's a thyroid issue. So I would talk to a neurologist about whether that lithium is appropriate. Who's the voice in the background is Susan Pinsky.
That is me. Evil like a fox. LLL.
Don't forget the SBC video. It's SB 640. It's
okay. I have to get ready for dinner now.
Okay, we got to get going.
Guys, we'll come back tomorrow. I'm gonna fix a couple things and make this a better transition too. So.
Hang on, and this is Suzanne's making a really great point. Right, she's talking about her psychotic loved one who was forced many times into the hospital, and it became kind of brutal. And that's not going to solve the issue. It's really we have better techniques available than brutality. Believe me. We are really moving fast.
I know. All of a sudden, everybody's asking a bunch of questions.
Yeah.
Because they know you're going to leave.
What is a good way of gaining insight, acknowledging nonverbal communication cues? Learn to, this is a very simple comment. I've talked about it before on this podcast. Learn to listen with your whole body, not just with your ears, if that makes sense. Listen to what you feel and think and hear and smell and when you're talking to somebody, as well as listening carefully to their words. Pedro, thank you on Dr. Drew After Dark. Those of you that don't know about that, it's on the Your Mom's House platform. It's more of an entertaining show, would we say?
It's more about sex and it's more
it's closer to Loveline. It's closer to Loveline.
Interview comedians like Nikki Glazer was on.
Nikki Glazer was on. It was very good. Tom Segura does it regularly.
Tom Green was on this
Tom Green is on this week. But do we know a time tomorrow? Probably around this time again tomorrow.
Know.
It's hard for us to predict, but I'm going to predict around this time tomorrow.
Don't know. I don't know.
So.
I have a couple of appointments too.
Okay. All right. We'll see what we can do.
This is always a good time.
But
home and
where's my
work anymore,
where's my guy that's calling me evil? He's not even very specific about that.
Stop it. Stop worrying
All right.
about that. God. Troll. You're a troll. How about that?
We don't take calls on After Dark, but we might someday. We take voice messages. Ooh, do you have the number?
You got email.
You can use voice messages. We have a call-in number.
Oh, I don't know what
323.
That is, but I know you can email.
Yeah, but that's for you can email me, Dr. Drew After Dark at
Go to your mom's house.
Dr. Drew After Dark at gmail.com. Go to your mom's house. Is that just
platform.
Look it up, the platform, and I'm sure they'll have the number that you can call in.
Nadab just texted me.
Oh, he's on the stream?
Okay, wait. Where do
Hold on.
we send
Hold on.
voicemails? He just texted me. We're getting a new link jingle too.
Yes.
Okay, let me get it.
Comedian was joking. All right, fair enough.
Okay, so
So the
yeah,
number
we
is
love that show. It's the best show ever, and we don't mention it enough.
switch to a lapel mic. We don't have fancy mics here in this
No,
town.
I'm gonna fix it. I just have to go shopping. I was just testing.
She's gonna go shopping for new mics.
Well, I'm gonna get like a.
She's gonna get something fancy for us.
Yeah.
So, you know.
Sorry, it's just this worked the best today. So.
Do I believe the late Minnie McCready's life could have been saved? Man, I worked with her for a long, long time after you saw her on TV. And at the end, all I can tell you is she went into a psychiatric facility. She had loved ones around her. She was motivated and went in and was going to stay. But this is one of the reasons I'm crazy. This is a perfect case of why I'm crazed about the homeless thing. She went to the facility. She met criteria for admission. They needed to keep her there, but she didn't meet criteria for a hold against her will. And after being there for a couple hours, she went, you know what? I've thought better of everything. I don't want to hurt myself. I'm going home. And they let her go home to a house full of guns. That I can never get over this. She was in Missouri or Arkansas at the time, or Tennessee. She was way far from me. I hadn't seen her in years, but I'd had contact with her over the years. I had deep concerns for her. And she'd actually been doing kind of well and recently decompensated after the boyfriend killed himself. That's where she really started to struggle. And her friends found a great place. I talked to her a couple times, motivated her to go in, which she did. And then they let her go because our laws are so screwed up. And she went home to a house full of guns. And a profoundly depressed patient should not be going home to a house full of guns. That is that. So she could have been saved. She could have been saved had she just stayed at the hospital. It would have been pretty straightforward.
So sad. So the phone number is.
All right, here's the number.
Okay,
818
253
253
1693.
1693. 818-253-1693.
Yeah.
And leave the voice messages there, and they collate them.
DrDrewAfterDark@gmail.com.
DrDrewAfterDark@gmail.com is the other place to send me your email messages. But 213-253-1693 is the number to call in, leave a voice message, and you will hear it on Dr. Drew After Dark. It may be a couple weeks before you see it, but we will do it.
So Nadav said they don't run any of the Drew sites, but you can start including it in the podcast descriptions moving forward. So they used to at the beginning, I remember.
Do what?
Put where to call in, where voicemails and stuff. But just if you call the 818-253-1693 number, you can leave a voicemail.
Catherine wants to know about transgenerational trauma. That's everything about what's going on today is about intergenerational trauma. We have massive intergenerational trauma in this country, and we have done woefully little about it. And I hope we come to terms with it.
Seconds.
All right, listen, I appreciate you being here. We will not be here this Sunday. Maybe we'll just work through the weekend and do these little shows.
Drew's got to travel.
But we'll be here the rest of the week trying to do these here in New York City. And I will be on Nikki Glazer again. It'll be at 7 o'clock Pacific, 10 o'clock Eastern. All morning tomorrow morning, as well as with Jim Norton before that, which should be interesting.
Yay.
And
him on After Dark.
We'll try to get Jim Norton on After Dark. That's good.
You have to get Nikki Glazer back.
Okay, Nikki back. We'll try to be here all week and have these fun little chats with you guys. We appreciate it very much. And Monday and Tuesday next week, I'm going to be in Denver doing a show called Daily Blast Live. So I don't think I'll be able to maintain any of this stuff. So we'll look forward to...
Yeah, I'm going to be in New Orleans. Also, check out the most recent Ask Dr. Drew with George Papadopoulos.
Oh, yeah.
It really did well. It was a great show.
Could you hear what she said? She said, "Go see George Papadopoulos and Simona Marjanti, his wife, who is a Russian operative."
Yeah, it was a great show.
You'll hear all about it.
And just catch up on all the previous things at drdrew.tv.
Yeah.
And we love you.
Thank you, guys. We'll see you next time.